Coming to the topic of the day, this about the causes for cramps, starting from depletion of minerals to plain aggravation of vata, causes of cramps can vary.
Definitely, even the Vegadharana also leads to Pindicodvestana, it's at cramps in the legs. Very commonly we can come across. Many patients, those who are having the constipation as a main cause, I mean, that is one of the important leading cause many times we come across in practice. Of course, the decrease in potassium, calcium, or magnesium and variation of these minerals definitely leads to there is a cramps in the legs, particularly during the summer season when a lot of fan or something like that it is used and people are not interested to go for cover their body with some blankets or something like that, then there will be totally their body is exposed to fan blow, that's the wind, so that leads to early morning cramps in the legs, very common one. And of course there is a blockages in the vein or maybe venous insufficiency and such type of things are there, that also leads to a lot of cramps in the legs. Otherwise, nerve involvement due to various reasons, old age, and sitting for a long duration may get cramp. All these things are very common. And of course, many things, including the sun and on this earth, everything is possible to cause an allergy. Similarly, for leg cramps, anything can be added: diabetes, arthritis, Parkinson, dehydration, mental imbalance, alcohol consumption, excessive work, so many things. Maybe the chemical drugs they are using it. So there are so many things are there. But individually, when a patient comes to us with a particular complaint, we need to take out a very clear history out of them, and then come to pinpoint what may be the cause in this case, and accordingly remove the cause. That is the only way we can handle these conditions.
There are many Ayurvedic points that are explained, but it is explained as Vataja Nanatmaja Vikara, Pindiko Dvestana or cough muscle cramps is explained as Vataja Nanatmaja Vikara, and all these things that you told, starting from dehydration or excessive body activity, sitting in irregular posture, or improper sitting and sleeping postures. Largely, it appears as if a vata problem, sir.
Definitely, that is whenever there is a direct obstruction to the path of vata, it leads to Pindicodvestana. That we need to understand that. Purely vata, but when sometimes even vata gets the avarana, then also we'll have these type of things.
Yes, sir. Because a deficient blood supply is told, and also again Purisha Vega Dharana, meaning habitual suppression of urge to defecate, is also kind of a blockage or kind of a avarana. Sort of blockage leads to peculiarly any sort of blockage usually leads to vata increase, sir.
Definitely, vata having chalaguna, anything which is blocking the chalaguna of vata and thereby making it is inactive. And vata is the one which has a gati. And if you something blocks the gati of the vata, definitely it is going to abruptly increase the vata locally, and that leads to usually pain sensation.
I mean, while searching for this word Pindicodvestana in various textbooks, I found a unique reference. This is from Charak Samhita, probably, if I'm not wrong. It says that if Vamana Virechana, if they are done without proper Snehana and Swedana, it causes increase of rukshata or dryness in the body, and then that can again lead to muscle cramps. So probably there is some rukshata or dryness involved in the causation of muscle cramps. It also again emphasizes the oleation and high dose of fat intake and then sweating treatment, which are very much required before doing any sort of panchakarma, sir.
Particularly in case of Vamana and Virechana, when there is a Vega, there will be rapid movement of diaphragm, and that rapid movement will be causing a negative pressure in the body. And if to overcome those negative pressures, if proper oleation and fermentation is not done, then there is a chance of damage to the muscle fibers, even the ligaments and the tendons. That also leads to lot of cramps and all these things. And even sometimes the patient may come with a teared muscle because of this reason. So that's why Acharyas are very clear that before going for any Vaman and Virechana such type of Panchakarma procedures, better to go for a proper Snehana and Svedana, then do the things.
And again, Mamsa Kshaya leads to Pindika Shushkata, dryness of or dryness and weakness of calf muscles. And then there is another last reference called as Mamsacha Jwara, fever afflicting Mamsa Dhatu. So overall, we will learn the causes. Then how to approach this, whether to approach this as a standalone symptom or we have to look at the whole body and how to.
So basic thing is that taking the history, when we are collecting the history from the patient, we need to assess all these things. So when we know that these are the possible causative factors, we try to elicit that whether any of these things are present with the present case. So in that sense, we need to check each and everything, whether in the deficiency states or any circulation defect or any Pentecost waste due to suppression of Purisha Vega or maybe due to constipation or something like that, or whether it is working too much, standing for a longer duration and excessively doing the things, increased Vata. All these parameters, whether he is not consuming regularly any grita or something like that, and whether he is not applying any oil to the body, any that such practices are there or not. So all these things one by one we will take the history through questionnaire, and of course certain times by observing whether the body is dry or it is sufficiently snigdha, then accordingly we can try to elicit and finalize that this may be the probable cause of this condition. Then most of the time, of course, it is primarily involvement of Vata, and sometimes due to some other dhatus, once again Vata is disturbed. So ultimately our target will be to nullify or quench the Vata or suppress the Vata in a proper manner by the way of Ushna, Tikshna, Snigdha Dravyas. So for that purpose we need to go for hot fermentation, and the proper Snehana and Svedana is the only thing that can be done. That will definitely going to reduce all these pains, and circulation part of it also will be increased because of the heat, the dilatation, and then the blood supply will be improving. Then of course it will break open the avarana. Then all these things, everything will be touched upon by using a proper Snehana and followed by a proper Svedana. That will give you the results.